Hi, I'm Joan, and this is Larry. We're going to talk to you about Proposition 23. You'll see it on your ballot as establishes state requirements for kidney dialysis clinics, requires on-site medical professional. This is an initiative statute. So what is the question behind Prop 23?
Should outpatient dialysis clinics be required to have a physician on site when patients are being treated, offer the same level of care to all patients, regardless of insurance, and report infection-related information?
Okay, so for those of you who don't have intimate knowledge of dialysis clinics, how do they currently operate?
Dialysis clinics have a specialty registered nurse, sometimes a nurse practitioner or physician's assistant in the clinic on the site. Each clinic employs a physician medical director responsible for meeting existing state and federal requirements. Each patient has a personal nephrologist who is responsible for treatment orders and must be available for emergencies. The Centers for Medicare and Medicaid Services requires all clinics to track quality indicators through the National Health Safety Network.
So then what would Proposition 23 change?
Proposition 23 would require clinics to have at least one licensed physician on site during treatment. It prohibits discrimination against patients based on their insurance status and requires clinics to report data on dialysis-related infections to the California Health Department.
Okay, Larry, is there anything else?
Yes, the process for closing clinics would change. There is currently no law that prevents a non-viable clinic from closing its doors. Under this proposal, clinics must obtain consent from the state health department to close a clinic.
And what is the fiscal effect of Proposition 23?
The Legislative Analyst's Office reports that Prop 23 would result in increased state and local government costs in the low tens of millions of dollars annually.
So what do the supporters say?
Well, the supporters say that the presence of a physician on site will improve patient care. They say that this proposition would improve communication and oversight between private dialysis clinics and the California State Department of Health.
And what did the opponents say?
The opponents say that Proposition 23 would make our physician shortage even worse and lead to more overcrowding in emergency rooms. They also say that the current system adequately handles the problems that occurs.
So in summary, Larry, what does a yes vote mean?
A yes vote means that at least one physician must be on site during treatment at all times, except if there is a shortage of qualified licensed physicians and the clinic has at least one nurse practitioner or physician assistant on site. It also means that the consent to close the clinic would require state approval and that the source of payment could not be justified as a reason to deny treatment.
So what does a no vote mean?
Dialysis clinics would continue under the present system and regulations.
Thank you very much, Larry.
And thank you, Joan.